What are the long-term outcomes after pancreatic MCN resection? Imagine a cyst in the pancreas that has the potential to turn into cancer if left untreated. That's what a mucinous cystic neoplasm is. When doctors find one, surgery is usually the best way to prevent it from becoming more serious. But what happens after the surgery? Are people likely to do well in the long run? Let's explore what the science says. Most patients who have their mucinous cystic neoplasm completely removed tend to do very well over time. The 5-year survival rate after surgery is often reported to be around 97%. That means nearly everyone is alive 5 years after their operation, especially if the tumor was caught early before it turned into invasive cancer. Even if the cyst had already become cancerous, the 5-year survival rate is still quite good at about 62%. This shows that surgery can give patients a real chance at long-term health, even in more advanced cases. Recurrence, or the return of the cyst or cancer, is not very common but can happen. It usually occurs if some of the tumor was left behind, or if the cancer had already started to invade nearby tissues. Factors that might increase the chance of recurrence include having symptoms before surgery, the tumor located in the head of the pancreas, higher levels of tumor markers like Ca19-9, or a smaller pancreatic duct. Doctors carefully monitor patients after surgery to catch any signs of recurrence early. Surgery does carry some risks. For example, a common procedure called distal pancreatectomy, which removes the tail of the pancreas, can lead to complications like pancreatic fistulas, leakage of digestive fluids, happening in about 10 to 16% of cases. Long-term effects can include difficulty digesting food because of reduced pancreatic enzyme production, or even diabetes if enough pancreatic tissue is lost. These issues can affect quality of life but are manageable with medical support. Compared to other types of pancreatic cysts, mucinous cystic neoplasms tend to have better outcomes. For example, patients with these tumors generally have near 100% survival 2.5 years after surgery, which is higher than some other cystic tumors like intraductal papillary mucinous neoplasms. This highlights how early detection and complete removal make a big difference. It's also very important that the entire tumor is removed during surgery. Leaving behind any part of the cyst can increase the chance of recurrence. Surgery remains the only proven way to cure these cysts and prevent them from turning into pancreatic cancer. Because these tumors tend to grow slowly, catching them early allows for effective treatment before invasive cancer develops, leading to these very favorable long-term outcomes. In summary, when a mucinous cystic neoplasm of the pancreas is fully removed, most patients enjoy excellent long-term health. The high survival rates and low chances of recurrence show how effective surgery can be. Still, patients should be aware of potential post-operative issues like pancreatic insufficiency or diabetes, and work closely with their healthcare team for ongoing care. Early diagnosis and prompt surgical treatment are key to maintaining pancreatic health and reducing the risk of cancer. Always talk with a medical professional for personalized advice and management options.